Hey everyone, Canada Jin-san here, and today I'm going to be talking to you about Japanese health insurance. This is called the 国民健康保険 in Japanese, and if you are going to be coming to Japan to live here for a year or more, this is something that's very important because you need to enroll in the public health insurance. After you enroll in insurance, you're gonna get a little card that's called hokensho, which is the insurance card, and this is really important anywhere you go. That's gonna be for your medical bills and stuff. There are actually two types of insurance in Japan. One is the public health insurance and one is for workers. But I don't know anything about the company insurance because I don't work at any company. So I'm in the national health insurance. To register in Japan for your insurance, you're gonna have to go to your city hall, which is your kuyakusho or shiakusho. Depending on where you live in Japan, the area, the little city that you live in, there's gonna be a city hall for every city. That is where you will go to get your insurance. The cost of insurance depends on the income of last year. So your first year in Japan will be very cheap because you obviously didn't work here before. The insurance cost is probably going to be between $10 to $15 a month. If you're working, it's going to go up. Though it seems like you pay per month, but actually the insurance prices are divided up into portions per the whole year, and I'll talk about that a little bit later. So once you're on this insurance plan, what does it actually cover? Does this mean that everything's free? Not exactly. It covers 70% of all your medical costs, and this is not just your hospital bill or doctor's checkup, but this includes dental, eye care, prescription drugs inside the hospital, and pretty much anything to do with medical stuff is covered by the insurance. Now, this doesn't mean that everything you do is covered by insurance. For example, I went to the dentist to get my teeth cleaned, and I had two choices. Either the health insurance one I can pick, or I can pay the one where you pay a little bit extra and you get some fancy features. So obviously the most general stuff that you're going to need that are necessary for your health will be covered by the health insurance. So this leaves you only to have to pay 30% of your bill. When you go to the hospital or doctors and you use your insurance card, they automatically deduct the money out of your insurance company. You don't have to pay the full price and then wait for it to come back. It's automatically done for you. So it is mandatory to enroll in the insurance program if you are staying in Japan for a year or more. If you have a 6 months visa, you're only staying here for 6 months, you do not have to register for this. If you're staying here for a year or more, and you for some reason do not register in this, you're gonna come into a little bit of a trouble once they find out that you haven't registered in this, and when you finally are told and forced to register into this and start paying. Just to let you know, just because you didn't pay for the last year or so doesn't mean you're gonna get away with not paying. Actually, you have to back pay. They'll make you pay for the months that you did not pay when you first came to Japan, even if you didn't partake in any medical whatever or anything, you have to back pay. So just as a warning, it's best to register right away because you're really not gonna get away with anything. Also, another big warning is for those coming on a working holiday visa or a visa that is only valid for 6 months, but they intend on renewing it and staying in Japan for more than a year or a year. There's a trouble that you might run into, and this is very important and stressful. I came on a working holiday visa, which is 6 months, and it can be renewed for up to a year. So the first visa was 6 months. And I went to enroll with the insurance, and they said, no, sorry, it's 6 months visa, so you can't enroll. And I was like, but I'm staying for 1 year, and they were just like, no, but it's not a 1-year visa, so you have to wait until you renew your visa, and then you can enroll. So for the first 3 months in Japan, I had no insurance. You can renew your visa 3 months before it expires, so I had to wait 3 months till my 6 months visa was almost expiring until I renew and then quickly get the insurance. And during that time, I had to go to the hospital quite a few times, and because I didn't have insurance, I had to pay the full price up front, which was about $400 I had to pay. And the good news is, though, when you do get your insurance, you do get that money back. So you have to save your receipts from the hospital, and then either you apply directly from the hospital, depending on the time, or you might have to apply directly with the insurance area in the shiyakusho or kuyakusho, and then you have to wait a few weeks till you get that money back. Some of you might be wondering about the costs of the medical bills in Japan, and you know, how much is it around gonna cost? And I've been to the doctors for many different things. I'm just gonna give you, from my experience, a general number as to how much I paid for my last visits to the hospital. To get your wisdom teeth removed, it's per tooth, and it's gonna be about $25 to $30 per tooth. To get your teeth cleaned, it's about $5 to $10 or less. To get a CAT scan, it was $80 for me. To get a pap test, it was about $40 to $50. And to give you an idea of how much it's going to cost for surgery or staying in the hospital if you're hospitalized, about $2,000 is how much my ex-husband paid for surgery on his belly button and 1 week stay in the hospital. So this is just giving you a general idea as to how much it's going to be costing you for your medical expenses in Japan. The bill in Japan is actually ranked per what the doctor does to you, actually. It's not just a general price, but it really depends on what you do. If you're new to that hospital, you're gonna have to pay a little extra for your membership card. You usually get a hospital card for every single hospital or clinic you're gonna go to, okay? And you get the membership card, that's costing you money, actually. Unfortunately, you have to pay. You're gonna get money for seeing the doctor, for talking to the doctor, for the tests. These are all ranked with little points, and you'll get that on your bill at the end, how much it actually costs. So everything the doctor has to do, basically they have a point system at that hospital, and it costs a little more. Back to your actually insurance cost, you're gonna get your insurance bill in the mail, and if you don't pay it for whatever reason, and it's just gonna keep coming in the mail, and eventually they're gonna give you a penalty fee, and the price is gonna go up for not paying. That's what's gonna happen if you don't pay. So pay your bills, and you can pay your bill at the post office or the convenience store. I always pay mine at the post office. I think it's the most easiest place. So this is what your insurance bill looks like. It's going to show the price that you have to pay. It's going to show the portion of the insurance price. Your insurance bill is actually divided into portions. I'm going to show you more information on that in a little bit. And anyways, it's going to show you the due date and stuff like that, your name and address and whatnot. As for your card, this is what your insurance card looks like. It's going to have your name, and it's going to have your insurance card number along with your address and birth date, and perhaps information on your visa expiry date or when this card expires, and when you got the card and such like that. Your card might look a little bit different from mine because it really depends on which city you live in. Also, when you enroll for your insurance, and at the beginning of every periodal year, I don't know really what to say, but you're gonna get this big ass paper, and you might look at it and be like, I just don't understand it. But we're gonna go through it a little bit so you can understand. So, as I was saying, the insurance bill is divided into portions, which are called ki. That's what this kanji says. So, ikki, nikki, sanki, yonki, which is like portion or parts or periods. And so my bill is divided into 10 portions. So it doesn't really mean the month, but more of a time frame. It's going to show the total cost on here, and these numbers might be very confusing to you. The one thing that I think is most important about this paper is where it says henko mai and henko go, which means before change and after change. And this is important if you're going to be moving, because sometimes when you move, your insurance rate is going to go up, and you might be surprised as to why is this insurance price going up, because I don't work and it's only supposed to be $10 or something per month, and it all of a sudden went up to $40 per month. Why? And the reason why, and I don't know if they fixed this, and I don't know if this is gonna happen to you, but it's happened to me every time I've moved, where the price goes up magically, and I call them and they don't know why, and then they find out why. The reason why is because every year you're supposed to tell them how much money you made the year before. But if you move to another city or area, it's a whole different system. They don't know your old information, so they don't know your income information. You need to tell them how much you made. After you tell them how much you made, they can adjust your insurance price. So that's the problem. They basically don't know your income from the previous year, because for some reason your old place didn't tell them, or didn't tell them yet, or I don't know really. But just to let you know, so that's the reason why your insurance price goes up probably. So the henko mai is the price that your insurance was, and henko go is how much they adjusted it to. So this is something important to be looking at. And basically that's all on this form that I feel is really important, and for people who, well, at least it's a really important thing for me to look at. But if I do find anything else that you need to be informed about in this video, I will leave it in the description. Or if you feel that I didn't mention anything in this video, then please leave a comment below. So that's basically the basics of Japanese health insurance and stuff you need to know. So thank you for watching this video, and I hope this video has helped you, or maybe it will help you in the future if you ever plan on coming to Japan or need information about the insurance. Please check the description below for important information on how to read some of the kanji that is on your insurance bills and papers. Thank you for watching. Bye!